Enkosi kakhulu Jessica, sibulise nakumbukeli ekhaya sise-garden route apha eMonti nalapho ke ikomishoni kamakulinganwe inikeza ingxelo malunga nophando lwayo ethe yalenza kwizibhedlele ezintandathu apha kwiphondo leMpuma Koloni. Nolu phando ke lulandela izikhalazo ezithe gqolo zifele ebantwini malunga nempatho engentlanga noko kwizibhedlele zeliphondo leMpuma Kapa ekwela candelo loomama kanye kwicandelo lokubeleka. Ezinye zezinto bebezijonga ke ikomishoni ngamalungelo abantu ukubana okanye amalungelo ezigulane ukuba ayahlonitshwa kusini na bekhangela umcimbi weziseko ukuba zime ngoluphi na uhlobo, kwakunye ke nabasebenzi bezibhedlele ezinto abana basebenza njani kwakunye nezigulana ezo. Ezinye ke zezo zibhedlele abathe batyelela kuzo iCecilia Makhiwane, iFrere Hospital, iDora Nginza, iBisho Hospital, St Elizabeth kwakunye ke nayo iLivingston Hospital. Ngalo mzuzu ke masikhwebe umkomishinala ophuma phaa ikomishoni yamalungelo oluntu uLeanne van der Merwe sincokole naye malunga nolu phando. Mkomishinala, masikubulise sikwamkele Mpuma Kapa TV.
Enkosi, bolela mna.
Sicela usichazele kolu phando nilenzileyo nifumaniseke ukuba yintoni engamandla kunobangela ukubhubha kwabantwana nabazali babo.
Enkosi, we found that a lot of the problem lies within the infrastructure of these public healthcare hospitals. We found that many of them are severely under-resourced. We do have an issue with aged infrastructure, poor maintenance, mold, and a number of other things. In particular, like we also looked at, the leaking roofs at some of the hospitals at Dora, for example, Dora Nginza. We have also observed a lack of incubators, a lack of machines that we can use to give phototherapies to the underdeveloped babies. So there's a lot of issues, and the point of the work that we're really trying to do is not to victimize anyone or to villainize anyone, but really kind of get a systems perspective of what's going on in these hospitals and why we are, why we have a compromised position when it comes to maternal and child health.
We've also had the issues of staff shortages that you guys talked about. How much of an impact does that have on the mortality rate?
Yes, I think the staffing issue is a very critical issue. We have to look at, it's just a pity that I don't have those ratios on hand, because if we look at the ideal ratios, it should be about, like one nurse to about 6 patients. We don't have that within the Eastern Cape. So yes, we do have a critical shortages of healthcare workers at all levels. What I'm hopeful about is the new curriculum, the healthcare, the nursing training curriculum, which has all been phased into a single 3-year diploma versus all the different ranks that we've had in the past, like your auxiliary nurse, your enrolled nurse, da-da-da-da. So yeah, I think we do definitely need a bigger output of nurses and midwives.
Zithini ke ngoku recommendations that you have put forward ezizawudila nomcimbi we-infrastructure nje buthethe nawo kwakunye ke ne-shortage le staff?
It is unfortunately a multi-sectoral issue. It's not just the issue. It's not this issue. It should not just be owned by the Department of Health. Treasury should come forward. The Department of Public Works should come forward. I went to some of these hospitals and they were tape closed with medical tape on the windows. We can't have that. That's such a big infection risk, So it's definitely not a single intervention that is needed here, and that's why we continue to emphasize that the point of this work is really not to villainize any single person or any single institution, but rather to look at it from a systems perspective, because there's the issue of cost and resources, there's the issue of human resources where we have critical shortages, there's the issue of lack of capacity. So definitely we do need a multi-sectoral intervention in order to respond effectively to this issue.
During the tabling of the report, we've heard that Cecilia Makhiwane was not fully cooperational with bringing forth enough information so that you guys can continue doing your job. How did that affect what you were doing as the commission?
Well, I think to the analyst, it led to a lot of frustration to the person who had like bits and pieces of information. But on the other hand, I also do want to say about Cecilia Makiwane that right now, when we talk about maternal and neonatal health, that particular project is a flagship project for the Eastern Cape. It's newly renovated. It looks beautiful. It's very modern. I've gone into the neonatal ICU. It's really up to par. But, you know, as you did say, in terms of providing us the critical information for us to do an analysis of what we really aim to get at, yes, it was lacking. And I think it was very frustrating on the part of the person who was analyzing that information.
So meaning there's not enough information about the administration of Cecilia Makiwane because of the lack of that information that you needed from them.
There is a lack of critical information that they needed to give to us because our guiding framework was the ideal hospital realization framework. And so according to what we have requested from them, some of the bits and pieces of information were insufficient, or they were outdated, or they just didn't have this information. But in terms of the layout of the hospital, I was very pleased with what I saw.
Commissioner Inkosi,
Kubulela men. Thank you.
kumkomishinala ke lowo wekomishoni kamakulinganwe kwiphondo leMpuma Kapa uLeanne van der Merwe thetha nathi ke malunga nophando abalenzileyo beyile komishoni bejonga imeko yezibhedlele zephondo leMpuma Koloni esithi ke okanye ubuninzi babo zidinga into yokubana amasebe ohlukeneyo abambisane ukuze kulungiswe ingxaki ejongene nezibhedlele ebangela into yokubana abantu okanye abantwana ebaphulukana nobomi babo zimveku ezo zintsana esanda kuzalwa kunye nomama bazo. Jessica.